Hi everyone, it gives me immense pleasure to welcome somebody of my name, that is Dr. Vishnu, who has secured an amazing rank of AML 3 in the INISS Neonatology exam. And it's difficult. Neonatology is easily, I think, the most coveted of the branches within pediatrics, and even with the seat number as well, that is also something that is, it goes very weird. Sometimes there are one seat only in the top two or three colleges, and sometimes it can be more. So it's a very, very competitive exam. And also he had a great rank of 162 in the NEET SS as well, and all of this just after passing out of MD. So it's an amazing result, amazing achievement. So how are you feeling, Vishnu?
Yes, sir. Thank you, sir. I am feeling very elated and actually quite lucky. I didn't expect this result in INSS.
Like, why do you say that? Like, obviously you were preparing through your final year.
Yes, sir. I had prepared, sir, and once the exam was had gone through, I had realized it was actually quite easier than NEET. So, based on that, once it becomes easy for one, it becomes easy for the other people also. So I knew that many people might have cleared. And the as far as the interview part had gone, I was actually I hadn't done that part as good as I wanted it to be. So I did not expect to come within the top four or five. But yes, the theory part I did do well. So I'd expected to qualify for the exam in the beginning.
So before we go to understand how, your preparation strategy, etc., let's firstly introduce yourself. Like, where are you from? How your academic journey has been?
Yes, I'm Dr. Vishnu. I'm from basically from Chennai. I did my MBBS from Meenakshi Medical College, Kanchipuram, and I did my PG from Maulana Azhar Medical College, New Delhi. I just passed out this February, and I'm working as a senior resident in Chennai. Uh,
Great, right? Like,
yeah.
so just you would have passed out in this year starting, and you had few
Yes.
months. Like, it's not especially with respect to pediatrics. It's a little bit different of a ball game from your exit exam to your entrance exam of your DM. So how did you make that switch? All that too within a matter of handful of months. Firstly, you had your NEET SS which you had to target, and then your INSS. So how did you kind of make that switch?
So basically, actually, Feb first week, our exams had gotten over, our MD exit exam. So after that, I had actually taken a break until March. And then when I knew that March 31st was the exam, was the NEET exam, that time I had started just revising whatever I had done in Nelson. I just had gone through all the important tables and images which I thought would were usually repeated. I had just gone through the last 2 years question papers and I had gone through that, and I had given a few GTs and test series, and I had just gone and given the exam blankly. I didn't expect much out of it. After that, when I had found out that I could have done a bit better if I just spent one more month, I could have come maybe under the top 100 or top 75 if I just put in a bit more effort. So I thought I'll prepare for INSS. And once they had pushed back the date, I knew that this is a good opportunity. And since the good thing about neonatology is that even though it is very competitive, the amount of portion is limited. You just have to stick to AIMS NICU protocol, and if you do that, you can almost definitely clear at least the theory exam quite good. So I had spent the 2 months and I had revised the AIMS NICU protocol twice, and I just gone and given the exam. So.
Like, I think clearing exams is a lot more of smart work is obviously there, but you have to got to do it smartly rather than hardly per se. And I think you did some things really well. Like, firstly, whenever we talk to students who are just passing out of the final exam, it's difficult to do all the videos, whatever's there in the app within those 2 months. So we always say the best thing is to do your test series, do your Q bank, maybe a little bit of your elite videos, and repeat topics. And that is exactly what you did. And also,
Yes.
you, even for the INI, you had a very clear plan, and like, you knew as well that is those limited sources that you have to be thorough with, and obviously would have concentrated on the repeated topics as well. So excellently done. And then when you came, obviously we've talked a little bit more. Can you elaborate on the INI neonatology part of it, because that might be helpful for the upcoming students?
Yes, sir. So the I9 neonatology part, as far as the theory part is concerned, almost every year it goes the same way that out of 80 questions, 50 to 60 will be just neonatology. And this time, I think around 54 or 55 questions were from neonatology. And out of those 54, 55 questions, more than 45 questions were directly from the AIMS NICU protocol. So you just had to read that and you are sure to get the qualifying mark. And on 5 or 6 were a bit ambiguous, which I had found out there were some questions from Clohati, which they had touched upon, but they were not quite tough. And the remaining general pediatrics part were mostly clinical and were from Nelson. So if you had seen those patients in the during your residency, you would be able to answer most of them. In the end, 5 to 10 questions are not in our hands that no one knows, and out of which 2 or 3 are from stats. One of which is always tough. The other 2 or 3 will be some slight, small calculation-based things, which are from neonatology as well as from stats. And those things, it is good to touch upon those just before the exam, and you'll be able to get those. But in the end, 10 questions, I did not know what they were, and they were very ambiguous with few options, and we were still discussing after that. So those are not in our hands. So whatever is in our hands, that is our AIMS NICO protocol. That once we do that, you'll be able to at least get the 50 questions out of 80.
Amazingly articulated, like having this
Right.
clarity that this is the cutoff and this is all I need to do. Like that is one of the most critical components of clearing exam. You don't need to be perfect to clear the exam. When you become a
Yes.
neonatologist, obviously you will go towards that perfection aspect of things. But before that, to clear the exam, you have to do it smart and you have to do limited things, and you have to obviously be thorough with them, right? And that's what you did. And then you say that you had a little bit of an iffy interview, but I think you would not have gotten it very bad because you have an excellent AML rank as well, so that includes your interview marks. So how was the interview, like, just for the next batch? Can you summarize how the interview was and what students can do to prepare for it?
Yes, sir, definitely. So, because usually we don't have an idea at all while going through the interview. But the thing is that pediatrics, most of these subspecialties, the interviews are very structured, and you need to have an idea of what they're going to, at least the pattern of what they're going to ask before you get into, which most of us don't have. Even I did not get an idea. So basically, what they do is that they divide it into 2 sessions. One is the morning session, and one is the afternoon session. The morning session is an OSCE. This is just for neonatology. The morning session is an OSCE, and the afternoon session is a Viva, which is a type of grand Viva from the other subspecialties in pediatrics. So I heard that they had divided it around 15 marks and 5 marks last year. This year, this session, it was 12 marks and 8 marks. So the 12 marks were an OSCE, of which they had put 3 case scenarios using videos and photos, and each case scenario they had asked around 3 to 4 questions, and these were all management based questions. The 3 case scenarios were, one was a preterm with RDS with PDA, and we had to talk about the Silverman Anderson score, the X-ray findings, and the ventilator settings which we would change. The second case was a case of neonatal seizures, and we had to talk about basically the flowchart of how we manage the seizure. But they had focused upon, they wanted to know that whether we know the dosage and what route we give and what dilution we give, and what is the rate of infusion also. So those specific details they had asked us. And following that, they had asked us the neurological examination of a neonate, basically the assessment of tone and the interpretation. And the third case was basically a case of neonatal sepsis. So they had gone through the they had asked us to interpret the CSF findings, the blood culture report, and the next step we'll take in changing the antibiotics. So these are all basically practical based things. So if we had seen, since we all manage this usually during our residency, it becomes clear cut, and you basically just need to go through all the flowcharts in NICU protocol just before the day of the exam, and you will not have any issue doing that. The afternoon session is unfortunately not much in our hands. We don't know what they're going to ask. Basically, they ask one question from each subspecialty. One they asked from onco, one from genetics, one from cardiology, and one was a biostats question. And the biostats question, even I don't know till now what they had asked, but apparently it was a Blunt Altman graph, which I had told it was a scatter graph. So I still had no idea what it was. But the thing is that we should, even if we don't know, we should be honest with them and tell them that this is what I don't know, but I'm trying to attempt this question. So, and they're very helpful that way. If we are very honest with them, they're very helpful. And they don't really mind that we are going blank on a question, as long as we're honest with them. The other question they had asked in genetics was on newborn screening of cystic fibrosis, and they had asked a question on congenital heart block using an ECG. That was the cardio question, and they had asked on cancer syndromes and genes causing cancer for the onco part. So these were just questions which were displayed on the PPT, and we had to answer them. And in case we had any trouble answering them, only then they would cross question us. Otherwise, we could just answer them and they would move along. So the afternoon part actually was very quick. It took only barely 3 to 4 minutes. Albeit it was very terrifying, but they actually helped a lot. They tried to make it go as smooth as possible, and they were not very particular that we must get it right or very strict with us.
Yeah, like especially one great thing you said was like they're basically looking for their to be resident, right? So they would expect them to be honest and upfront. Even if you do not know, it's okay, you can open the book as a resident, right? Obviously not in the exam, but as a resident, if you don't know, you can open the book and you can go through it and come back and treat the patient. But if you're not being honest, then that creates a lot of doubts, right? So then when it comes to preparation during your MD, because you're one of the achievers or rare people who could crack it just after MD, which is usually not the case in terms of with respect to your pediatrics assess, because especially pediatrics third year is not very light everywhere. As we know in pediatrics, how it happens is third year the responsibility is given to a good degree.
Yes,
So how did you, obviously you could crack it. So your through MD, you had done a good conceptual reading. So what would you advise somebody through their MD, how to go about it?
So basically, so the first 2 years of MD, you must be sincere with your work, with the ward work. You cannot run away from that, because the patients are only going to teach you a lot and the rounds are only going to teach you a lot. And we won't have much time during the first year. During the first year is very hectic physically. Second year becomes hectic because of our thesis work. So during that time, the only thing we can do is whatever cases we see, we go back and we read them. So that and the good thing in my institute was that the other day they always used to ask questions on rounds. So at least for that sake, we would read something and come. Otherwise, it would not be very good. Otherwise, they would actually scold us a lot. So that was actually in one way very a good thing. Not maybe at that time, because we were getting tired of them, but they actually made us read somehow indirectly. Once we get into third year, actually, our, like you said, our responsibilities increase, but our physical work becomes a bit less. So we actually used to be responsible for anything when it comes to as the workup or the mortality of any ward. So we were actually responsible for that. So but we had juniors working under us, and we had senior residents above us. So they used to give us some time, since we are exam going PGs. We used to get enough time to read, and that was a good time to start reading Nelson thoroughly. So I always started with only the questions which we see in the ward, and the cases which we see in the ward, and those cases which are frequently asked in the theory exam. So I had just covered that and had covered around maybe 650 to 60% of Nelson by the time I had finished my MD exit exam, because I was just focused on just clearing the exam. After that, it was more about just revising only what I had done. I did not try to do anything extra. And I had made sure that I'd gone through the test series and as well as the allied test series. And whatever topics were asked in the allied test series, those topics, if I had not done in Nelson, I did go through that in Nelson, so that I had made sure that these are important previous year topics that I don't miss out on. And that actually helped me a bit during the NEET SS exam. Post the NEET SS exam, I had actually given up on Nelson, because I knew that 1 month I cannot do much of Nelson. I knew that there's one thing I'm sure of, that is NICU protocol. 50 questions are going to come from that. So better be thorough with that 50 questions. The rest 30 questions, we might know or we might not know. We can give our best on that. But the 50 questions, we should not go wrong in those. So I had just made sure that I'd gone through NICU protocol twice, and even started a third revision also, because each time you read NICU protocol, you think it's a small book, but every time you read through, there is one line that you know that you had missed out on the previous time.
Yeah, like, and also like you did one excellent thing, that you always went back. Like we always say that there's no substitute to Nelson. If you're doing elite, or if you're giving you these daily tests, mini tests, it doesn't help unless you go back to your primary reading source which you had through your MD. So you have to do your Nelson well, at least obviously the important portions, if not cover to cover. Infectious disease, etc., you might not be able to do cover to cover, but the
Mm.
important parts, doing retrospective always helps in the long run. So like, in you are obviously the center stage of the result, but around your success there will be a support system. So like, would you want to thank your support system?
Yes, definitely. My family were always there with me. My entire family, my parents, as well as my brother and my grandmother. And I had a very good set of friends from my PG, as well as the place where I'm doing my senior residency, as well as my partner. She's also doing her senior residency now. So they were all behind me. And even though I did not have much faith in myself, they were sure that I might come get through each and every exam, because I have my main plan was to do senior residency for 1 year and then probably give a proper attempt next year, because I was always of that since I had not completed Nelson fully, I wanted to make sure that I give a full reading of Nelson cover to cover at least once in my life, because it's the only opportunity I'll get. So I was basically in that plan, but they were always pushing me that to give each exam with full heart. So I did try in the last few days, especially even during my senior residency at the college in Chennai. They did give me a few days off just before the exam so that I could give my best. So I was very thankful for everyone. Thank you, sir.
Very nice, and it was great talking to you. I think you did great
Thank you, sir.
in both the exams, and especially it's always nice and refreshing to talk to someone who just post MD clears the exams very well. And it was very nice to listen to your analysis of how you prepared. That was something that future students should definitely take away from.
Yes, sir.
Okay, Vishnu, very nice talking to you. Goodbye.
Thank you, sir. Thank you so much, sir.